right, good. Let me just take you off. Good health and welcome to today's edition of the Black Health News with Dr. Mike and George. A lot of things to talk about today, and a lot of infections out there, some issues around alcohol and cancer, other things that we need to kind of get engaged in. All right, let me do it again. Good health and welcome to today's edition of the Black Health News. I'm your host, Dr. Mike Lenor. Let's do it at 1 minute. I'm going to add you to the stage. And 1 minute. And you smile a little bit.
Yeah, we got to do that.
All right, I'm ready.
Okay.
Good health and welcome to today's edition of the Black Health News. I'm your host, Dr. Mike Lenor. This is Dr. Mike. Mr. Pearson, welcome back.
Thank you, Dr. Lenor. Thanks for inviting me on the program today. Appreciate you.
I don't know why I'm inviting you because you're part of the host. So let's start again then.
Okay.
All right. And at 1:30. Good health and welcome to today's edition of the Black Health News. I'm your host, Dr. Mike Lenor, here with our co-host, Mr. George Pearson. We're going to give you some of the latest issues impacting the Black community in the area of health. So let's start out, first of all, Mr. Pearson, what you're seeing in the office.
Well, again, it's viral season. We're seeing a lot more COVID, a lot more influenza, the flu, and RSV. And again, the discussion is how do we prevent that, because antibiotics don't help these particular illnesses.
Yeah, there's no question. My biggest problem comes when I have to discuss with a parent that a child has a virus and that this virus is not susceptible to antibiotics. The other thing, because what happens is antibiotics are good for bacteria, but they don't do anything for viruses. And we're now in danger, Mr. Pearson, of overusing antibiotics to the point where some of them eventually might not work.
They're looking at antibiotics that don't work on viruses and the resistance as one of the top new killers in 2030. And that's far off, but just think about it, that the antibiotics that we have now won't be effective against the infections we have now because we've used them too much.
You know, the other thing is that all the parents want cough medicine. And as a pediatrician, the American Academy of Pediatrics says we shouldn't be prescribing them because they're dangerous. Now, I don't believe they're as dangerous as they do. But certainly we know that cough medicines don't work in children. Sometimes they're too sedating, and sometimes children react to them. And so consequently, no such thing as a cough medicine. But, you know, my mother seemed to have some kind of some kind of pharmaceutical background because she always was able to take care of our coughs.
Well, first of all, they couldn't afford to take us to the doctor, so they had to do home remedies. They had to use the tea, the honey, the saffron, all those kind of things that we now know have some medicinal capabilities in terms of reducing cough and helping with our immune system.
Yeah, but she would pack us up with mustard plaster. You don't even remember that one.
Oh,
and Bengay was good for everything.
And Vicks. Don't forget Vicks.
And so my mother used two things: ignore the cough and go to school, or Bengay for just about everything.
Yeah.
I bet there are many of our listeners out there who have some of these remedies, and maybe we can figure out a way for them to
share them with us.
To share the information. So let's move on now to the bird flu. Let me play a little something for you.
Okay.
Just issued a health alert because a child tested positive here. Officially known as H5N1, bird flu is an influenza virus that usually sticks to birds, but sometimes jumps to humans, but very rarely in this area of the country. In California, most cases come from infected dairy farms. So unless you're hanging out with farm animals, you're probably safe. but you and your healthcare providers should keep bird flu in mind when diagnosing unexplained illnesses. Stay safe. This is one flock you don't want to join. Yeah, so,
Well,
all right,
yeah,
so
that's true.
yeah, so now we're talking about bird flu. There's a lot of publicity out there about it, but should the general public be concerned about it?
Again, unless you are working on a farm, working in animal husbandry, or a individual that has to have ongoing contact with animals, particularly farm animals, no, I don't think it's a concern. The bigger concern, and we talked about this, was we've got all these viruses with names occupied to them, which people are more worried about than COVID, than influenza, than RSV, than vaccination for whooping cough. And I think that we have to kind of like keep people on a reality base, as well as a discussion around that antibiotics don't treat viruses.
Yeah, well, I got to agree with you that we really need to start to think about the fact that there are going to be a lot of these viruses. There are going to be things that we can, take care of, things that we can't. There's going to be another pandemic of some sort. So I think people need to start to get in a mindset that says, I'm going to, during this period of time, at least wash my hands. Sometimes wear a mask if I think I'm going to be in a place where other people are going to be gathering in large numbers and you don't know who they are. So we better be ready for a lot of these other pandemics.
Well,
yeah, go ahead.
We have to be more vigilant, and again, proactive as opposed to reactive. When parents were asked why they didn't get the vaccine, some of the issues were they didn't trust the vaccine, they didn't think they were effective, they didn't believe that COVID existed as a disease. So we're having a lot of misinformation, and it borders on a disbelief in science and education.
Yeah, and especially about vaccinations. I'm really kind of exercised of vaccinations, not so much in California because it's illegal not to be vaccinated. But across the country, Black children especially are not vaccinated. Now, when I first started in practice, Mr. Pearson, there would be 60 patients in my office, maybe 70, 80. Now they're 15 to 20 because of the vaccinations. Vaccinations for children do work. I think the whole COVID thing kind of muddled the discussion. But there's
we're a generation of vaccines. We grew up on vaccine. You, I,
you're right.
We all were vaccinated. You had to go to get the I remember polio and sugar cube and
Right.
and the fluoride treatments with the that they brought to school. That you had these at school, so you just didn't get it from the provider's office. You were able to. It was a part of the school matrix too, and now that's kind of gone.
Yeah, no, and I agree with you on that. But I think vaccinations are so critically important, and we'll continue to mention that as we go about doing our news. All right, next, let's look at this. Alcohol can increase your risk of certain types of cancer. Yeah, even that glass of wine. The more you drink, the higher the risk. For African Americans who already face health disparities, it's even more important to understand these risks. Stay informed, stay healthy, and take care of yourself. Catch you next time. All right, there's another. This came out this week.
Yeah.
And even a little bit of alcohol increases your risk of 7 different types of cancer.
Oral cancers, GI cancers, liver cancer.
But George, the scientific community has always had hits out for 2 drugs: alcohol and coffee.
Tobacco.
And the next day, the next day there was an article from a research study that suggested that drinking coffee increases your lifespan. But I'm not saying alcohol should never be used outside moderation. And most people know what moderation is. But I don't think that just a couple of glasses of wine a week is going to make a big difference in whether you get cancer or not. Moreover, I think the reverse is also true, that not drinking alcohol is going to prevent you from getting cancer. And so I just believe everything in moderation. I think alcohol should be consumed in reasonable amounts. But I don't think people should be terrified that a couple of glasses of wine a week is going to increase their risk significantly of cancer.
I think that the conversation that particularly the African American community and communities of color is when these products come in the community, are they beneficial or do they tend to cause more havoc? For example, what I say is that I should be able to get fresh fruits and vegetables at the corner store like I'm able to get alcohol, tobacco, and whatever. And there's just not that balance. So, and essentially, it has been a stress reliever for us. And so we have to kind of look at how the ways we address stress and trauma in our lives to maybe not need that glass of wine as much, or in Steve Jobs' case, the $1,000 bottle of wine.
Yeah. Well, you have to kind of explain that piece.
Well, I think that from a social and political standpoint, certain substances have been placed in our community to do us harm, even fast food. So we have to be mindful of what we're consuming and the amounts that we're consuming, because how you consume things in your age 20 is different to how you have to consume it, in my case, 69. And I think moderation is the key, understanding that there's level of toxicities to these issues and how to be proactive as opposed to being reactive.
Yeah, but I think too often the general public is not given the opportunity to look at these things in context. And so when you see a headline that says alcohol causes cancer, I mean, I think that needs a much more of an explanation. Now, we're not advocating for drinking, that's up to you. But anything in moderation, I don't think is going to increase your risk substantially of cancer. And you watch, in another 6 months or 8 months, a study will come out that says that alcohol, red wine, and chocolate make you a beautiful person. So I think you have to.
Doc, we have the cardiovascular and cardiologists have discussions about the 1 or 2 glasses of red wine, not an issue. Now, you don't hear that as much. And what you have to say is, gee, why don't you hear it as much? Because not only is it not politically appropriate, it says there's an alignment with a particular specialty and the industry. That's what people are saying.
Right. Well, yeah, I think everything in moderation.
I agree.
I think that's most of what we want to cover this week. I think next week we'll be looking at some of the stories that you're looking at in your own newspaper, explaining how they impact the public. But let me do this again. Well, let's see. Well, we've covered a lot of things this week. We talked about the infections, a bit about the bird flu, talked a little bit about the issue of alcohol and its impact on cancer.
Vaccines.
And vaccines. So I think that's quite a bit for 1 week. All right, so I want to do that again so I don't have to edit it.
Okay.
Yeah, well, everything in context. So this concludes this week's issue of the Black Health News. We'll be with you next week with some of the stories that you might be reading out about and some of the things that we know that you should know. So remember, as always, Mr. Pearson, health is your biggest asset.
Thanks for having me.
So let's protect it.
You too. Hey, best season. Happy New Year.
All right, let's see how we can do that close again at 15. We need something sexy. Hold a second. I wonder if I can pause this video somewhere here. I don't have to.
You're welcome. When you have your health, you have everything.
Yeah, right. Okay, well, you all, let's okay. All right, well, that concludes this week's edition of the Black Health News. Each week we'll be here with some of the latest information that we think is important to you. We want to say how our hearts extend to the people of Los Angeles because of those terrible fires. And I think maybe next week we should talk about fire safety that people can implement around their own homes so that this tragedy won't happen again, even here in the Bay Area. So our sympathy extends out to them. But most of all, let's say health is your wealth. Remember, health is your. I didn't get that right. Well, that concludes, Mr. Pearson, this week's edition of the Black Health News.
Thank you.
Covered quite a bit. Our
Yeah.
hearts extend out without question to the people of Los Angeles for these terrible fires. I think it's something that will continue to happen because of obviously climate change, and I think that you, as individuals, for yourself and your family, need to have aspects of fire safety, and maybe we'll deal with that next time. So
I want to say Happy New Year to everyone that's watching the program, and appreciate you. And we believe that health is your biggest asset.
So protect it.
Yeah.
Okay, so let's do that one more time. I don't know about the Happy New Year piece, but let's just see how it turns out. All right, so let's end this recording. All right, and then I'll download it and break it up, and I'll show you some of the pieces. Now, my website is michael.lenor@gmail.com, and my password is, I believe.
Doc, will you text that to me? Because I don't want to get it wrong.
Yeah,
I want you to text it to me.
I got you. All right, well, let me go to work on that, and I'll get back to you later today.
Hey, we'll see you next week, huh?
All right, yeah, we're gonna.
Thanks for having me.
We're gonna refer. No. Thanks for being engaged, and we got to get this down to a much smoother pattern. I think having the little videos helps. But transition to them weren't as smooth as I'd like. But let's just see what we come out with this one, because it ain't gonna be nothing on Mount Rushmore.
Right. And for us, I think it's pushing the content. As we push the content will, again, if you're the only game in town, pretty soon people get a hold of you and say, okay, that's what he's saying. That's what they're talking about. What are you talking about this week? That's the kind of spin we're going to try to push on this and all the platforms. And so like this weekend, I'll be on my Facebook show having conversation and talking about, pushing things toward the site. Once these things start coming up, we'll look for them.
Yeah, and I'll give you some stuff to put on your site.
Okay, good.
All right, thanks, good, man.
Hey, have a great weekend, Doc. Take the wife. I say hello and thanks, huh?
All right, bye-bye.
Bye-bye.